I was in business. I actually graduated in mathematics at the University of Waterloo and was on a course to be a chartered accountant. And I decided that I just didn't find that form of work rewarding. And at the time I had problems with mono, so I was spending a lot of time actually going to the doctor. And I just admired the doctors, and I liked the concept of a healing and helping profession. And so it motivated me to kind of change course and apply to become a doctor. Doing today is even, I think, was unimaginable even 5 and 10 years ago. So we are now, for every patient who comes here, we will break down the genetics of their cancer, identify the key mutations or abnormalities, if you like, that are causing or driving the cancer, and then try and match that to the new treatments that we have. I play golf, I relax, I play squash, so I like to be active, and I like to not work on my days off. I think it is nice to have a break and to enjoy life, and so I like to remain physically active. The other thing that I do that I've really enjoyed, which actually I can attribute to Princess Margaret Foundation, is I've done the Ride to Conquer Cancer. The first year was a little bit of a challenge, but I took up cycling, and I found that that's a fabulous way to kind of remain active and keep fit. And this weekend, for example, I'll probably be doing a bike ride both days.
I think oncology, as a physician, it's an exciting field because things are moving quickly. We've seen lots of advances. There's lots of new drug treatments that are being developed. So from that aspect, the scientific aspect, what you're able to offer patients, it's exciting that things change. From a physician to patient interaction point of view, you form really meaningful relationships with patients and their families. They're lasting relationships. You feel like you're making a big impact in patients' lives, even if there's limits to what you're able to offer in terms of treatment. So those are the things that appeal to me in terms of medical oncology. I think many things inspire me. The idea of making a difference in patients' lives who I treat, trying to provide them with the best possible care at a very difficult time in their life and dealing with illness, explaining treatments, the side effects, all of those sorts of things. That inspires me to come to work and work with my patients, and contributing to research, feeling like I'm making some small contribution in terms of moving the field forward and trying to develop better treatments for patients with cancer. The challenge with cancer is that it's not one disease, it's many, many different types of diseases. So I think in terms of conquering cancer, making improvements, helping our patients to live longer, live better, finding cures for patients with certain types of cancers, all of those things I think are achievable in my lifetime. It's tough. It's tough when you leave at the end of the day to try and shut off all of the things that go on at work and all of the many things that you have to deal with. But I enjoy spending time with my wife, my 2 young children, seeing family and friends, and watching movies from time to time when there's time, although it's difficult. It's a busy job.
I'm a clinician at heart. I love patients. I love not just the curing part, but the preventative part as well, and forming the relationships with patients. I mean, oncology is such a hard journey, and to just being able to, I guess, provide a holistic care is something that I enjoy doing. So I just don't look at the disease, I look at the whole journey for them, and then you end up bonding with patients' families, and you understand how hard it is for their family members as well. So at least the way I nurse, it's more of like a family-centered care. I love working with my nursing colleagues. They've been fantastic, and just seeing the quality of care that they give to patients while adhering to very stringent protocol requirements. The fact that they can, take very important requirements but then deliver it in a way that is therapeutic, and they just don't see the patient as a subject, but they see the patient as a human being, and developing that relationship I find inspiring.